any spiritual program, but in particular the 12 steps. It doesn't have to be one doesn't have to be theistically oriented or God-centered in their life.
Okay, so again, the idea of the difference between spirituality and religion, that the two are not the same.
Exactly.
Really plays a part. If you're just joining us, we're talking this evening about spirituality, addictions, and healing. Our guest is Dr. David O'Connell, a psychologist from the Karen Foundation. We welcome your calls at 610-378-0426. One thing that struck me as I was going through some information about this topic is there is quite a lot of evidence that spirituality and meditation and really relates to the physical. I think most of us would assume and agree that, well, gee, this may affect mental well-being, but it can have some physical effects on the body. Mm-hmm. Can you comment on that?
When you mention that, Lee, I'm reminded of the theologian Teilhard de Chardin, who was a Jesuit paleontologist and Jesuit priest. And he said that we are not physical beings having a spiritual experience. In fact, we are spiritual beings having a physical experience. The mind-body continuum, mind-body-spirit continuum, is in fact, can be conceptualized that way, that matter, the body, and spirit really are not two distinct things. We can see them along a continuum. They have a relationship. So when we practice spiritual practices such as meditation and prayer, it's not that big of a jump to see how something which may originate in the spiritual realm can infuse itself down, so to speak, to the matter or material level of life, which includes our bodies, and affect it. We certainly know that the mind affects the body, and the mind is consciousness, and according to people who are spiritual, the consciousness has its origin in spirit. So this is the link, this is the connection. So when one practices a spiritual practice, and there's a lot of research showing, for example, that meditation normalizes blood pressure, reduces some of the toxic neurochemicals in the body, which have a role during stress, but which should go away after the stressful experience, helps normalize those. It has what we call cardioprotective effects on the heart. It helps balance the heart, keep a healthy cardiac functioning. It has a whole myriad of effects. And it starts with a mental or spiritual process, and it has a cascading effect down into the body. And this has been repeatedly shown in some pretty impressive research in a variety of medical and psychological as well as religious journals.
Right. Well, again, our topic tonight is spirituality, addictions, and healing. Our guest this evening is Dr. David O'Connell, a psychologist from the Karen Foundation. We do have a caller. Good evening. Welcome to Medicine in the News.
Good evening. I was up at Karen around 10 years ago and had a good experience meeting Father Bill. And he taught me a lot with spirituality. Around 3 years ago, I've lost everything I've had after one of the major plants closed here. And I was wondering if now, do they have any programs to help, like if you were to more or less relapse into it? And we no longer have any money, or I haven't had a good job in 3 years after 25 years. I was wondering if they have any programs that are available up there.
Appreciate the call, and that's a good question.
Thank you.
Well, we do have a program specifically for individuals who have relapsed back to active addictive illness, and I think the caller suggested that in fact has happened. It wasn't just a spiritual relapse or a falling away from a spiritual program, but actually picking up a chemical and getting back involved in active chemical use. We have an intermediate care program, which is our relapse treatment unit. And for individuals who are financially challenged, oftentimes things can be worked out financially to help assist those individuals. We have scholarship money available. And outside of Karen, there are local cost-effective both outpatient and intensive outpatient programs, and in other inpatient programs. There's a lot of opportunities for inpatient care at Karen and beyond Karen. So the caller doesn't have to needlessly suffer just because of finances.
Right. So maybe they should call the Karen Foundation and just
that would be a good place to
start.
start. Talk to an intake counselor, find out more about their financial and clinical background. And my experience has been that that often something can be worked out and somebody can get the clinical care that they need. Certainly, this individual could immediately get back into a 12-step group, right. Immediately begin to go back to prayer and meditation and affiliation with other chemically dependent individuals through the 12-step or other support groups. And that's something that doesn't cost anything.
Right.
So I wouldn't delay. I would get on the phone tonight and try to make it happen.
Great. Well, thanks for that insight, and thanks for the call. One question that comes up, especially from my being a physician, is how do I talk to patients about this topic? And even more, should I even talk to patients? Is it okay? Is it ethical?
That's a good question. There is now enough research to justify, I believe, and my colleague Dr. Deborah Bavino and I just did a paper on this and a workshop on this at a family practice trainers program last week in Pittsburgh on introducing spirituality into medical practice. There's now enough clinical and basic research on spiritual approaches to inform doctors that they can comfortably and reliably recommend involvement in a spiritual program for patients with a wide variety of diseases. The research has consistently shown that church and religious affiliation is very positively correlated with health, both prevention of disease, dealing with the disease when it happens, and rehabilitation, faster and better rehabilitations. Religious and spiritual beliefs can be very comforting. An attitude of positivity and optimism is correlated with health and is often engendered by spiritual involvement, spiritual practices. And probably the most impressive research is on spiritual techniques, for example, prayer, meditation, contemplative practices themselves, especially when somebody is going through a crisis or going through an acute medical problem. So a physician can go anywhere from a suggestion or just acknowledging the patient's spiritual background, and I believe that the physician should inquire about that when he or she does a medical evaluation. And there's research showing that patients really would like to have their doctors investigate and talk with them about that area of their lives, the spiritual area of their lives more, and it increases trust and the quality of the physician-patient relationship. So a doctor can broach the subject, can even give some advice or direction in assisting a patient to read about meditation, learn how a meditation approach, go to a spiritual retreat, seek out a informed clergy person to help discuss spiritual and religious issues, all in the service of, it's another dimension of the healing process which can work with the medical approaches in promoting healing, and that seems to be what the bottom line is.
So patients, you don't think are, I guess the word would be turned off or feel threatened if a doctor brings that up in terms of forcing, again, a religion, but you're saying, again, if we couch it in the context of spirituality separate from religion, most patients feel comfortable with that.
That's true. Spirituality, couch it in terms of research, of clinical experience, and the patients, in fact, research shows that the patients would like it addressed, and it's hard for them to make the first move. Well, it's hard for them to broach it with a doctor. I think what's clearly inappropriate is a physician introducing his or her own religious beliefs or practices or making recommendations based on their own personal religious or spiritual background with patients, because that could lead to misunderstanding, and it has the danger of imposing one's values and beliefs on a patient, which is not the business of medicine.
Right. How would you recommend then, along the lines of what you were saying, how can a patient bring this up? What should a patient say to their doctor if they want to have that discussion with a doctor? What could they say?
Well, if a patient is spiritually oriented, for example, let's say the patient is a recovering alcoholic and is attending a 12-step program, and they sit down with their family doctor, we direct them at care to let their doctor know that they have an addictive disease and there's certain medicines or medical procedures which would not be indicated for them. They could bring that up in that context, that there are certain medicines that I'm told by my addictions doctor that I'm not supposed to have. And in fact, I'm in recovery, and in fact, I work a spiritual program every day, and I'm interested in how you feel about that. I'm interested if you have any advice for me on that, and is there any direction you could give me on harnessing the spiritual practices in the service of health? So I think a patient can take the lead, but I think the recommended way to broach spirituality in the doctor-patient relationship is, in the course of history, make it a matter of procedure to inquire about the patient's spiritual and religious background.